nice to see you.
Yes, I love that I've been seeing so much of you recently.
It's very funny, isn't it?
I know. All the different events and everything.
It's
So
been
funny. I feel like we
funny.
went years without seeing each other, and now I see you everywhere.
Well, it's funny you say that because I've been particularly exhausted from events lately, and I realized that we had COVID for so long.
Yeah,
No events were happening in person for so long. We
we
forget what it
lost
was
our
like.
stamina.
Yes,
Yeah.
yes. And I got old in that time, you
Yeah.
know?
I'm always happy I go when I go to events. I'm always happy I went, but like there's always a piece of me that's like, but I could be sitting on my couch right
A
now.
1000%. And I think that is like the name of the game with so many things. Same with the
Mhm.
gym, right? I
Mhm.
freaking hate going to the gym, but I'm always like, oh, that was probably pretty good for me, you
Good
know?
for you. Yeah, I'm
Yeah,
not there yet in
yeah,
life. I was
yeah.
like an avid gym goer, residency killed that, and I haven't.
Well, so let's start there. Let's talk about your
Okay.
path to doctorhood.
Yeah.
Did you always know that you wanted to go into the reproductive field?
Yeah, so I actually found my way into medicine by wanting to go into reproductive medicine. When I was in high school, a couple from my community was just very open about their fertility story and how IVF changed their life. And back then, it wasn't like as talked about as it is now. And I hadn't really heard much about it. And I just thought like this is like literally the coolest thing that you could change somebody's whole trajectory of their life with this thing called IVF. And actually, my father's a physician, but like I guess I just always wanted to be different and not be the same thing as he wanted me to be or whatever. But ultimately, I just thought it's the coolest thing that you can do with your life. To be, to have your source of income also like your passion and be able to like really change people's lives. And so I did the whole pre-med thing, and then it's like this funny thing. The more effort you put in and the more you make it in that path, the more you kind of like can't see yourself doing anything else, or at least that's how it was for me. Um, Went to med school, and then I said, let me do OBGYN because I always wanted to be a reproductive endocrinologist. I actually loved OB so much that I almost didn't do REI. Um, and I actually was still moonlighting at Cedars. I don't know if I ever told you this. Moonlighting at Cedars till a couple of years ago because I just like I felt like you work so hard, you get all these skills, and then you're just gonna like stop. Um, but ultimately, I decided, I'm gonna regret it if I don't go into REI, and I did it, and I'm really like it's the best job. It literally is the best job every single day. It's not, like lost on me how this is the best job. You can't
I
convince me with anything
mean,
else better.
it's very clear in your work that you consider it the best job, which I think is so nice and an
Yeah.
extra added bonus. I mean, most people who go into REI or any field of medicine for the amount of schooling you have to do, clearly you want to do it.
Yeah. Yeah. It's true.
Um, but there's so much good about your job. You get to see people, you get to, travel this road with them. I feel like
Yeah.
I have no patience to go back to school in any capacity, but if I did, if I had it to do over again, I would certainly consider it.
Yeah. I mean, at this point in my life, if like sometimes people are my age and they're thinking about going to med school, and I'm like, are you crazy?
Yeah,
But then I didn't know better.
right. And so were you married already by the time, at what point did you get married into your education?
I actually got married in my second or third year of residency. In my second year of residency, which is, for the Orthodox Jewish world, can feel sometimes a little bit late.
Hmm.
And I particularly, my group of friends was all married, like, I don't know, the second we got back from college,
Yeah.
or Israel, sorry, even younger than college. And so it was tough. I really felt like the whole dating scene in medical school and residency um, is hard. It's really hard. I mean, it's hard in general for everyone, but first of all, you have a group of guys that thinks that you're too committed to your job and you don't necessarily want to be a mom in that world,
Sure.
or also in the Persian world. And then you have a group of then you're just then just dating in general just sucks, and everyone is weird, and you have to kiss a lot of toads before you find Prince Charming. And you're tired. You're working really hard, and you don't want to necessarily spend your one free night, going on a date with some awkward
Sure.
Joe Schmo. So, um, but luckily I was introduced to my husband. So it's so funny because I had so many friends, they were all setting me up, but ultimately it was like some connection I had just kind of met who set me up with him. And he had this was a guy who had done OBGYN residency and then wanted to torture himself some more, did anesthesia residency. I bumped into him in the line in the cafeteria one day, and then he set me up with his family friend who's my husband. And in the beginning, I still joke with my husband that like he didn't like I was like, I'm so much more fun than this. I just would like fall asleep on dates. Um, we literally once went to like this fancy restaurant, ordered steak, wine. I still remember like, and I was like, I'm not gonna make it. I'm literally gonna fall asleep. Like we're gonna have to pack this to go. And I
Oh.
remember literally driving home and he's holding the steak in his hand. Eating it. So that's
But he
kind of the
clearly loved it about you, obviously.
yeah, you know, I think the right person was gonna find it as something that was like a pro, not something he had to deal with. And it's definitely been hard for him. He was definitely, you know, alone a lot of my residency. And actually we had my first kid in my third year of residency, which was extremely hard on many levels. But my husband was also a single parent for about a year. So
Of a newborn, basically.
yeah, he had him on the weekends by himself. Yeah, of a newborn. And this is like not somebody who is necessarily like great with kids growing up or had a bunch of, I mean, he does have younger siblings, but it wasn't like that type, you know?
Hmm.
And he had to learn.
So, something I've been considering and talking about lately is just the questions that the things we talk about when we're courting, right? Like it's very normal to be like, I want 3 kids. Oh my God, me too. I want 3 kids. I want to start in 2 years. Oh my God, me too. I want to start in 3 years. But we're not saying like, well, how far would you go if we don't get pregnant naturally? Because we haven't had to think about it so much until now. People are talking about it a lot more. And I just wish that were a normal part of the conversation.
Mhm.
Were you and your husband immediately on the same page in terms of kids? So, like you said, you come from a Persian Orthodox Jewish community. So, kids is like the number one reason you marry somebody.
Yeah, my husband's Ashkenaz Jewish, so a
Okay.
little different.
Okay.
But yeah, no, we both had like similar, and those were things that we spoke about when we were dating, which is something I like about my world of dating. That you make sure that a lot of the goals are on the same page early on. We both knew we wanted a bunch of kids, and um, I think that I don't know, I don't know where I was going to go with this.
That's okay. I love it. It's like you're back in
You
residency.
asked me
Um,
something, and I'm trying to remember what you
were you
asked.
on the same page in terms of like how many you wanted, when you want to start trying?
Oh, yeah. So yes, we were on the same page about like, you know, approximately how many. And I wanted to wait a year because I felt like I hadn't even gotten a chance to know him like by ourselves, married for a year. But he kind of wanted to try almost right away. So we did, and we got lucky. We got pregnant right away. And then, but the next time we tried, it did not happen so quickly, as you know.
Mhm.
And it took a lot of months. And I remember this distinct conversation that what you just said sparked my memory of like, yeah, at what point do you start thinking, like, okay, should I take the next step? And as at the time, I was an REI fellow. So I was, I guess, just like so into the details of it all the time that I was like, yeah, like I mean, I can control when I ovulate and I can take this med and I can do this. And it's almost like you think you almost take too much credit for the control that you have. Um, and it just wasn't happening. Everything that I tried, and I was reading into the details too much, like how thick is my lining? How big is the follicle? Should I have waited more? Like, and then I was thinking, should I take letrozole? Because I'm like borderline PCOS, you know, really long cycles. And I had so much guilt about taking letrozole. I was like, you know, maybe I'm playing God, maybe I should give it a little bit more time, maybe
This
this,
is
maybe that.
while you're studying to be a fertility doctor.
Yeah, I think that's why. I think I was just so in my head about
Mm.
it. Like, you know, I think I had a hard time being like, okay, I'm going through what my patients are going through. Like, I'm like, no, I'm different. I'm the doctor. Or, like maybe I'm pathologizing myself too much. Meanwhile, like if anybody has like a 5.5, 6 week cycle, I'm like, yeah, take letrozole.
Yeah.
So, I remember my husband saying to me, like, why do you think God is so what's the word? Punitive. Like, why do you have this? Like, if letrozole is what you're supposed to take or what you would tell your patients to take, like, what's wrong with it? Like, you're right. I don't know. Like, I don't know why I thought like maybe I'm trying. I think there's this complex when you're a fertility doctor, like, you know, too much control. And it's different when it's your patient, but when you're doing it for yourself, I don't know, maybe I thought I was like abusing some power. I
Right.
don't know.
Well, can I ask you one quick thing before you finish this story? Did you feel pressure, guilt, shame from being within the Orthodox Jewish community? Like, well, those women don't seek treatment. Why do I have to? Or was that not in your head at
Not
all?
at all. No, not at all. I felt guilt because of my job. So I waited to have to start trying for baby number two because I was a resident, then I had my boards, and then I was a fellow, and it was like always like finding the right timing. Which, as we all know, there really is no right timing, and unfortunately, you can't plan it to a T. So I think I had a little bit of guilt of like, maybe I should have just started trying when I felt like it was the right time, not like maybe it was a lot of like, this is happening to me because, like,
Mm,
this is happening to me because I waited. This is happening to me because I'm trying to do letrozole. This is happening to me because I think that I can play X, like too much
mm.
control. I'm ultrasounding myself too much. It was like a lot of like, God is punishing me because, and it's a really unhealthy way to think. And also, why do we think God's so punitive?
Right. And also very common and normal. And we all think these, it's happening
Yeah,
because
yeah,
right, like I
yeah,
lost the baby because I had
yeah.
2 cups of coffee or
Right,
whatever.
right, right.
Oof, it's a lot.
Yeah, it was a lot. Thank God. Okay, so then I got pregnant with baby number two a few months after trying like a few of my letrozole rounds in. And as you also know, that did not end normally. So um, basically the day before I was going to take my oral boards, I decided it was a good time to get an ultrasound, my 13-week ultrasound. And note to self, like never get an ultrasound before you're going somewhere, before you like,
Important.
yeah, like I just, yeah, it can ruin everything. So I went in expecting not, I had like a feeling that whole pregnancy that something was off. Like I was scanning myself too much. I was having the techs scan me every day. And one of the scans, I was like freaking out. I'm like, oh my God, I'm not measuring. Like the size is too small. And then I realized, like, and I called my mom and she was like feeling bad for me crying. And then I realized, oh, okay, miscalculated the dates. Like I just, this level of anxiety was like already there. And then, so I guess I just didn't, I was uneasy the whole time. I went in for this ultrasound and they try to reassure you, no, I just can't see. I just to be able to see a little bit better. And I already know like something's off. And I'm looking at the scan and I'm like, okay, like what is that thing? Then I was like, okay, you're being too crazy. Stop. Like unless they tell you something's wrong, nothing's wrong. So obviously then the tech goes to get the MFM. I don't remember if she was a fellow at the time or one of the new attendings, but she had just pimped me for my oral boards a couple days before.
Oh my
And she
God.
came in and said, like, very straight, which is what I appreciate and how I like to give bad news also is like, no beating around the bush, just deliver it, rip off the band-aid. She was like, I have really shitty news for you. And I was like, it was the brain, wasn't it?
Mm.
I just like, I knew I saw this thing that kind of looked like an amniotic sac herniating up the brain. And I was like, it's the amniotic sac. And she said basically I had something called an occipital encephalocele, which is very rare. It's a herniation of the brain contents out of the back of the brain because there's no, I guess, like fusion. Um, and and she told me like best case scenario, this is gonna be really bad. So I like immediately kind of knew what I wanted to do, but I was just like in shock. It's like that stomach dropping feeling of like, oh no, this is the moment, everything changes. Um, like this bad dream, pinch me, like just I had tried so hard. I finally got pregnant. Like I didn't think that that was going to happen to me. And then, yeah, I was just like crying and crying. And I was like, oh, I have to go back to a lecture in an hour. And she was like, you're not going to lecture in an hour. Like you're going
Mhm.
home. um, and yeah, I went home. It was a little bit hard because my husband's not medical, so he like wanted to really take his time, process, understand on like a logical level what's going on. And I just like, no, don't you get it? Like it's bad. It's not good. Um,
You were ready to
and
move on like right away.
that's how I am. Like
Yeah.
that's like I need to resolve this so I can move on. But as an Orthodox Jew, I wanted to consult with my rabbi and make sure it was okay. There was a rabbi I consulted with a lot of times as a resident if I was allowed to do certain cases. So I knew I pretty much knew he was going to say it's okay. I mean, the one thing people don't really know about Orthodox Judaism is that um, there is a lot of room for terminations if it's medically necessary. And people automatically think like it's that you're going to get a no, but they're actually it's quite lenient depending who you ask. The more knowledgeable I find sometimes are the more lenient ones. Um, and
And
so
we've talked about this on the show before in various circumstances, but I think it's important to add that part of the reason is because the life of the mother is valued so highly,
yeah,
which not to say it's not valued elsewhere, but it takes priority and precedent in a lot of the cases where
yeah.
leniency is given.
Yeah, and the life of the mother includes her mental health, and that's
Right.
something that I think is taken lightly otherwise, like if this is going to put her in a state of anxiety, if and that sometimes gives you like the leniency to terminate an otherwise healthy pregnancy even. It's not so simple, but I think people often group us in with other religions that are, very black and white about it, and we're not at all.
Hmm.
So yes, we called the rabbi. He hadn't heard of this before. He was like, "Is it like anencephaly?" Which he had heard about, and I was like, "Kind of, but different." So then, before I know it, like the head of Mount Sinai neuroradiology is calling me on my cell phone and asking me questions for the rabbi, and he's like, "Well, we could do an MRI and we can look at it." And I was like, "It's not going to change anything." And this is something that I started telling people is like when you do go to your, you know, figure, your rabbinic figure or whatever, you should kind of like advocate for yourself and let them know what page you're on. Because I think that the rabbi assumed I was like trying to see if I could save this baby. And as a medical person, I knew that like, I was told best case scenarios, it's really that. And I was like, I'm not trying to like have some miracle happen. I don't really want to keep this baby.
Hmm.
And then once the rabbi heard that, he wanted to think about it some more. And he's a really busy, big rabbi in New York. The next day I was flying to Texas to take my oral boards. Yeah, this part was like just insane. I was just so sad. It's like this feeling of like you're housing this life inside of you, but you're going to terminate it. And even though it's not normal, I had guilt. And it's like, bouncing around inside of you and you just know it's going to end. And it's also this feeling of like you go to sleep, right in the beginning of pregnancy, you start to feel like your pelvis is a little bit more swollen. It doesn't, if you lie on your stomach, it doesn't feel the same. It's like this feeling of like all these things, these pregnancy symptoms that aren't really going to be fruitful for you. And it's just depressing.
Yeah.
So yeah, I'm on the airplane and I'm just like, okay, I can't deal with failing my boards and also needing to terminate this pregnancy. I need to like cross one thing off the list and then deal with the next thing. So I went to Texas. I had a massage at the Ritz-Carlton.
Nice.
That's what I do before my tests. And
So smart.
yeah, and I still didn't get the answer from the rabbi whether I was going to be allowed to or not. And I was just like a ball of anxiety because,
Hmm.
like, to be told you have to like take that. I knew it wasn't going to happen, but still, to be told you need to take this like baby to term, which is what some of these women in Florida are going through, it's insane. So right before I went to get my massage, I got the call and he basically told me like it's fine, you can terminate it. It doesn't sound like it's good. And I'm telling you, like the relief
Hmm.
that I got in that moment, was probably better than my,
Massage.
really expensive massage.
Yes.
And that's another thing. It's like, I don't know. Listen, ask your rabbi, don't ask your rabbi, it's your personal decision, but there's something nice about having something like kind of like taken off your shoulders. Like
Yeah.
it wasn't like my decision. It was almost like I was being told like, yes, this is not normal. Like you don't need to go, you don't need to put yourself through this. Um, I don't know. It was
I
like a
love
nice,
that thinking about it though,
yeah,
because also when we're in it, I mean, you seem like you were very clear and very rational and very level-headed, but so many times we're not, or we think we are, and we think very clearly one way. And we know that like a year later, looking back on it, we might feel differently. And so it's like if somebody else can help validate whatever our gut is telling
yeah,
us in that
yeah,
moment, like run
yeah,
with it, right?
yeah, yeah.
Yeah.
Yeah, and I think if you're a person of faith, especially to get that validation from something that you really like believe in,
Yeah.
um, just makes you a little bit more at peace. I don't know. So yeah, I mean, I was the luckiest person in the whole world on my way home from my oral boards, which I passed. Woo.
Congrats.
I bumped into one of the head of the family planning divisions in Cedars, And she was one of the oral board examiners. And I was just, she's like, "How are you?" And she thought I'm like upset about the test. And I was just like, "I have to terminate this pregnancy." I had to like word vomit everything coming out. And she's just like looking at me with like so much compassion. And she's like, "Give me a second." And at the time they were telling me I had to wait till the following Thursday for operating room time,
Mm.
right? Talk about access to care. We're talking about,
Los
like
Angeles. Oh, you
Los
were in New York.
Angeles.
Yeah. Okay. Los
No, that at
Angeles.
that time I was already in LA.
Okay.
Los Angeles, like good insurance. I'm a freaking resident in this or fellow in this
Yeah.
hospital, right? Like, and I have
So
to wait till
infuriating.
Thursday.
Hmm.
Yeah, and like, to wait a week is really horrible. Like
It's terrible.
it's just bad. And then you're telling like women, in other states that you need to actually fly to New
Right.
York or to California or whatever it is. It's every single day that you're carrying a pregnancy that want to end. It's really hell on earth. It is.
I've said the way I think about it, and I've been there many times, the waiting to become unpregnant is a special kind of torture when all you want is to be pregnant, you know?
Yes.
Oof.
Yes. Yes. You want it over so you
Yeah.
can move
Move
on
on.
to the next try even. And you still have all that anxiety about whether that next try is going to work and
Of
everything like that.
course.
So she came back and she was like, "I got you booked for Friday, which was the next day, 1:30." I was like, "Oh my God." Like to this day, I tell everyone that I don't know, like it was such a chesed, which is a Hebrew word for like just kindness that somebody had done for me. And I told her, "I don't know how to thank you. I'm gonna pay it forward one day."
Hmm.
That is like my thank you for like
Yes.
things that we cannot, there's no payback for, right?
Hmm. I love
Um,
that.
and I did many years later get the chance to pay it forward, which was really a full circle moment. One of my partner's patients she had a IVF pregnancy. Unfortunately, it didn't end well, and it was a miscarriage. She needed a termination. Everybody was out of town. It was Christmas week, and I came in on my day off to do her termination. And
Mhm.
I actually just bumped into her not long ago, and she was like, I didn't even recognize her. And she was like, "I can't even tell you how much that meant to me." And I was like, "You can't tell me, but I know. I already know."
Mhm.
So,
I love that.
yeah, it's
So, okay, I want to unpack this a little bit. In school residency, how are termination for medical reasons talked about? Like, what did you learn? What did you know? How do they prepare you? Because look, bedside manner, of course, every doctor is going to have a different one, but I think some handle terminations kindly, gently, and some don't. And I'm just curious if they talk about that in med school.
absolutely. I mean, so I went to med school and I did my residency at Albert Einstein in the Bronx. It's a very pro-choice institution. So there was no, I think some people specifically go to that OBGYN program because of the training that we get in abortion care. So I don't think I ever had an experience with somebody not being kind or good bedside manner. And I always say the family planning attendings, the attendings who literally specialize in abortion care, are the most compassionate, empathetic, judgment-free people that I know. Literally,
Mhm.
like you cannot go into that field if you are not going to be that person. Um, and to this day, they're some of my favorite people. So we were definitely, we were taught about abortion care. I think everybody got love, whether it was an elective abortion or, um, and I say elective with quotes because what I like to say, which I really truly believe in, is that I have yet to meet somebody who is smiling as she got her abortion done. And the word elective is just so relative, right?
Mhm.
It just
Yeah.
means there's not something medically wrong with this fetus, but usually people have like life circumstances that are telling them this can't be right for me.
Or like you said, mental health is part of,
Right,
those health choices. It's
right,
not to be
right,
dismissed, and that's
right,
a big part of the problem right now.
right, right. Yeah. So yeah, we had a lot of training in
Okay.
abortion care, in elective abortions in first trimester, second trimester, um, and the bedside manner was always paramount. And
Do they talk about bedside manner in school?
So in medical school, yes, they have started like bringing in bedside manner as like a part of the curriculum. And we would have these like sessions. I think I can't remember. It's been a long time. We used to call them, I think, Pearl, and every letter stood for something, and it was about the bedside manner. So I think the new generation of doctors is definitely being trained a little bit better than the older
Mhm.
generation, where it wasn't so important. And then in residency, it's not like we had um, lectures on bedside manner, but it was like lead by example, and also like if you weren't nice to a patient, like somebody was observing you and somebody was going to say something. Not that I'd really ever seen that happen. Maybe with some of the old school like
Yeah.
GYN oncologists, we used to make fun of them. Um, but for the most part, no, just it was kind of like just understood. And it's just that what I love so much about the field of OBGYN is that I think in general, we're really like it's so special to be able to share life moments with your patients that you yourself could have gone through or have gone through. And it adds a whole new level of like connection and empathy. And I think your patients feel it. Like you may not say things. Like today, I told you I had a patient who had to diagnose an abnormal pregnancy and I really didn't have any wise words other than, I still believe you're going to be a mom one day, which you need to hear at that moment, but I think like the hug and like I didn't tell her I've been through this. I don't think it's the right time to unload onto a patient, but I think she could just feel like I felt for her, and that's I hope what she needed.
It is. It is what she needed. And it's everything. I mean, I talk openly that I switched doctors halfway through my journey because I had done so many second opinions, but they were all with men, and they were all incredible men. There was nothing wrong with them. They were wonderful doctors. And then I sat in front of a woman who had been through it and I was like, "Oh my God, my world is upside down. I need to switch to this person because there's just a different level of empathy and understanding."
Yeah.
Which isn't to say that like men who go through this don't have that either. But for me in that
No, and
moment, it was
yeah.
important.
I know. And I've heard so many people say that sometimes they prefer men because it's almost like an extra layer of like maybe like because they haven't been through it, they're so respectful of it, some of them.
Hmm.
But there also was that report, did you see it recently that came out that said that patients of female doctors are like more likely to, I don't know, live long. It was like some
Yes,
cool statistic that I was like, yeah, because we're awesome.
of course. I mean, it makes so much sense. It makes so much sense. And only now are there as many women doctors as men? And they're probably still not as many, but like we're getting there,
Right. But specifically in our field, yeah, for sure, we're
in
seeing a
your
lot of
field.
female.
Yeah. Okay, so you have this termination. By the
Yeah.
way, quick sidebar about my own, because I reduced from 3 to 2,
Yes.
and my MFM was actually an Orthodox Jewish man, and he wouldn't do it. Is that interesting?
That is interesting. Well, to be fair, I don't know. I don't say who he was or
I
whatever, but
won't. I won't. I loved
to
him.
be
For the record, I loved him, and he got me somebody amazing. But he was like, I don't do them. I just don't.
right. So, to be fair, reductions are a skill, and I think you have to be doing a certain amount of them to feel comfortable with them. So I don't know if it was for religious reasons or not, but even if for religious reasons, from a medical ethics perspective, um, you are allowed to say this isn't something I do, but you do have to be able to then refer that patient to somebody
There's
else. So
somebody who can help. Yeah.
yeah, I think that it's a hard line. If you say I do elective abortions, it's a hard line to draw.
Right.
Which case do you like? Then you're playing God. I think your case is necessary. I think your case is not. It's almost easier to say. And by the way,
I
as
just don't do them.
clinics,
Hmm.
yeah, as clinics, it's a different like kind of license as well. So like for example, most REI clinics, we will do D&Cs for missed ABs, but we can't do D&Cs for normal
Pregnancy.
yeah.
Yeah. So fascinating. And I don't know which case, why or where. And like I've talked about this too, in terms of access to care. I
Yeah.
had full insurance, full medical reason that I needed the reduction, incredible team, incredible emotional support. And still, I had to show up at like 8 a.m. on a Saturday morning, and the doctor had to drive in from far away. And it was, X amount of
Mm,
like, it was
mm,
still like a clandestine operation,
wow.
even though it wasn't shrouded in anything unethical or secret. It's
Wow.
crazy.
Yeah. Yeah.
Anyway, back to
And
you.
your termination is like its own difficult, I don't know, mental, emotional case. I mean, so you didn't have one, right? From what I remember you telling me that was clearly abnormal. You just had to reduce it to let the other two kind of that's gotta be such a mind fuck.
It was such a mind fuck, but I had already been through so much that I was like, okay, it's like they're giving me a chance to get like 3 rough drafts so I can have one final copy. And so, not to discount that that was a life, but I very much felt like if I get to one, I'm
This was your
from these
journey.
three, like this is what
Yeah.
I'm meant to do. And so I was
Yeah.
really okay with it. And then the fact that I got two was just a blessing and a miracle. And like,
Yeah.
so
Uh,
I very much was at peace with having to reduce completely because I
yeah.
just wanted to become a mom at that point. I wanted that to be the pregnancy that
Right. You
worked.
were like at such a point by then.
Right.
But it's also kind of nice that you were able to like get that perspective and really hold on to it because I can
Yeah,
see it really messing with somebody.
totally. Um, and you know, so every now and then I see my two run around with like a close in age person. And I'm like, oh my God, that's what it would be like to have three, you know, which was like never possible. It was not ever going to happen for me. Like, honestly, my life was at risk. The baby's lives were at risk. But I
Yeah,
see when I see them in threes, I'm like, wow, that's what this would have been like, you know?
so I tell a very popular question is, can we put two embryos back? And
Yes.
I totally get it. I mean, these patients have been through hell and they finally get the chance and they're like, let's just knock it out and get two. And I tell them all, I don't think people understand. It's not like in our colloquial language how high risk twin pregnancies are and how much more so triplets.
Right.
So, they increase all the risks of pregnancy, high blood pressure, diabetes, preeclampsia, hemorrhage, C-section. But I think the risk that the patients care the most about is that the preterm delivery, which can lead to NICU stays and, God forbid, permanent developmental delays.
Right.
So, after all that work to go through, finally get your pregnancy, finally get your baby, and then, God forbid, have your triplets born like so insanely prematurely early, and then they have, long lasting developmental delays. It's a
Right.
lot.
Yeah. And that risk was not worth it to me at all, because I just wanted to get my healthy one and I got my healthy two, you know?
Yeah.
Okay. So you do this termination. Um, I've seen so many complications from DNCs, by the way. That's a whole nother podcast topic, but
Yeah, we could totally talk about that. I
I
seen
mean, it's scary. It's scary
Yeah,
because
it's
people going
underrated.
through infertility, especially like you're saying, emotionally, they want to just move on and get it over with. And so they go for the DNC early, like 7 weeks, 8 weeks, which I get. It is torture waiting to become unpregnant, but then God forbid there's any complication or any scar tissue. And then they go through so much pain of even figuring that out,
Yeah,
you
so what
know?
I would say is that by and large, we have a lot of data on first trimester DNCs, and they're very, very safe. And the amount that have scar tissue, et cetera, afterwards and infertility afterwards is minimal, really.
Minimal,
I mean, we
yes.
always see the bad cases and they speak, they're loud, but for the most part, people are able to get pregnant right afterwards. And what I've seen on the contrary is patients that have done the med ABs and they didn't fully expel everything. And they come for their they think they're done. They come for their saline ultrasound for the next transfer, and they find something
Yeah.
there. So nothing's a hundred
Also,
percent.
yeah.
I think good follow up, which is something that in fellowship, I'm sorry, in residency, when we did all these MVAs and DNCs and Med ABs, we didn't necessarily follow up with the patients because it was a different patient population. It wasn't infertility. We let them have their Med AB on their own and only really come in if they needed to. Now, given how many like things that I've seen afterwards, I would almost have any patient that had a Med AB come in a week later. Let's look at your endometrial stripe, make sure you, as much as we can,
Yeah.
expelled everything. I think the follow up is important.
So true. And so different in gynecology than infertility, for
Yes,
sure.
yes.
Okay, so you were like raring to go next time to get pregnant. And did you go back on letrozole?
Yeah, I went back on the letrozole. Took a few months, but then I got pregnant, thank God. Beautiful, healthy girl. But during the pregnancy, I was told, and again, there's another place I got very lucky, but my co-fellow, she wasn't my co-fellow, she was the MFM fellow who was a friend of mine because we were contemporaries. She knew I'm already like so anxious, whatever. I don't want to be in the room with a tech only to have them stare at me a couple times and come tell me later something's wrong. So she came and did my anatomy scan for me. And everything was measuring small, like really, really small, like less than 1% small,
Oh
like
no.
the fetus's long bones. And I freaked out. I
Of
was like, oh my
course.
God, like this isn't normal again. We're already at like 20 something weeks, like much different to have a termination at this point,
Yes.
and also not black and white. And it's like every time you get in that chair after you've been given bad news, um, it's like you're just waiting for the other shoe to drop.
Always.
Yeah.
Always.
And that freaked me out. And then I remember I went to probably the same Orthodox Jewish doctor that you're talking about, who's great and we love him. And he was
Yes.
like, listen, he's like, it doesn't look syndromic. It doesn't look like there's anything genetically wrong. It like maybe you just have a baby with small lung bones.
Yeah.
And he's like, you won't know. Like for all we know, you had it or Zach had it or whatever. And like we just didn't look this closely. And thank God she's gorgeous.
Yeah.
Maybe her long bones are a little short, but yeah, like if you
She
looked at
functions
her,
perfectly.
she yeah, she she
Yeah.
she she gets what she needs. She looks gorgeous, and yeah, it's
I
just
love it. And then you
you
went
look
on to have a third
yes, you guys.
because you're
Yeah,
you're a machine and I love that about you.
yeah, I used to joke that I wanted to be a grand multip, so that's five babies because I was one of five, and everybody would make fun of me. Um, but every kid that I have, I lower that number a little
Yeah.
bit.
Yeah.
It's hard working full time and having the kids at home, and it's actually much easier to work than to
Yeah.
be at home.
Yes. Yes. Somebody wanted to have a meeting on like a Sunday at 4 and it was like within an infertility community. So I was very sensitive and not be like, but my kids have activities. Cause I used to be like,
Right,
oh, so nothing else matters because your kids have
right,
activities. And if I never have kids, my
right,
schedule, right? But I
right.
was like, it would be best for me when my family has care between 8 and 5 on Monday through Friday. I
Yeah,
was trying to be really sensitive, but
yeah,
that's the reality of it.
yeah, 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 totally.
Um, what are you excited about in the field of reproductive medicine that's like ahead? Because I feel like there's so much right now.
Yeah.
I know for
What
you personally,
what excites me also scares me.
mhm,
So I'm excited about how much we're learning about like genetic testing of the embryos, and right now we do PGT A for aneuploidy, abnormal chromosomal number. We do PGT-M for single gene mutations that we know about. PGT-P, which is polygenetics disorders, are starting to be on the market, and they're starting to be like whole genome analysis and looking for de novo mutations. And I think it's going to be exciting and scary. Exciting because there are going to be some people. I have a very complex patient, or she's not complex, but her family history is complex with a history of ALS, and it's really difficult to. Unfortunately, her parent that had the ALS passed away, and we can't get DNA to make probes. And so it's become this whole kind of like jumping through hoops, trying to figure out how do we test these embryos.
mm,
And with this new technology that we have, it's going to be hella expensive, but she, in theory, could probably test these embryos for the de novo mutation without having to like scavenge the earth to find. So
wow,
it's exciting in some ways, and ALS can be devastating. So that's like a really, you know,
important one to
nice
circumvent if
important one
possible.
to be able to,
Yeah,
yeah, and it's not just due to one gene. It's complicated, but and then it can be scary because sometimes we find things and we don't know what to do with them. We don't know what they mean, and they freak us out. And I just am like, there are some genes that are linked to other genes, and I sometimes wonder, and I don't think we're there yet at all, but I sometimes wonder, could we be selecting out a group of genes and selecting in a new thing? I
wow.
don't know. I have no idea. It kind of fascinates me. There's also like the CRISPR genetic editing, which is you haven't heard of that?
I've
Yeah.
heard of genetic editing. I haven't heard of the CRISPR.
The CRISPR is like this technology where they can like try and like fix the genetic makeup, and it just freaks me out, but it's also really
Amazing.
insanely, yeah.
It is. Okay, and now I always like to ask people if there's one piece of advice or a cliche or a saying or a phrase maybe your grandma said or you say to your kids or anything that you think about often. I feel like pay it forward is a very good one and like a paying it forward
Yeah.
in general is a really
Um,
nice way to live.
yeah, let's cheat and use that one because a lot of times I think people ask, how can I repay this person? What can I get that question a lot. What can I get my doctor that she's gonna like after she did my delivery or whatever. And I'm like, personally, like you could bring me flowers or chocolate, or I mean, I love flowers, but like it's not like the knowledge that it did something for you and you're going to pay it forward, I think is so much more meaningful.
Mm.
And obviously you can't go get like do IVF if you're not an REI doctor, but there's other ways. And I think that to be able to tell somebody who did you a chesed or a kindness, like, and I've used it sparingly, but I've used it a few times on people who really helped me out, gave me of their time. Like, this is something that I'm going to pay forward, and then try and be a good person and like pay it forward.
Yeah.
It's not easy, but the same way it wasn't easy for them to give up their free time,
Right.
it's why we have to. I tell all my patients, like, we really got to help each other out, especially as women. We have patients in here that they need to make this crazy schedule and this crazy schedule and do this thing and that thing. And I think a lot of people look at it as like annoying, like, you're a patient, you need to get in line. Like, this is the way this office runs. And to an extent, yes, right? Like, we all need to be able to run. But at the same time, like, what if we all looked at it as like, let's help each other out. You're a boss, babe. You need to be able to do your fertility treatments and also, film your movie and become actress of the year. And so, not that all my patients are actresses, but we have a lot of we
We
have
are in
a
LA. We
lot of
get
that
it.
industry.
Yes.
But we need to figure it out. It's tough if we can accommodate schedules, if we can bend a little bit over backwards and not be overrun and not be, a doormat, but just don't look at it as like, you know, this is an annoyance, but more like we're women helping other women, and part of that is lifestyle. And I don't know. That's
I love
really
that.
that's what you're doing
Thank
every
you.
day.
Thank
Yeah,
you.
we love you.
Coincidental. I love you. Thank you
Yeah,
for being here, Sahar. And you already know this because I send lots of people to you, but anybody looking for a reproductive endocrinologist in the Los Angeles area, could not recommend her more.
thank you. Thank you. Okay.